Optometry 2040 is really about harnessing trends to capitalize on the opportunity and minimize the risk. So there's obviously really practical things you can do, but at a bigger level, if you can take that own mindset into your own career, that's a really powerful tool for creating positive personal changes and positive business opportunities. And obviously, if you're looking for some ways to capitalize on those opportunities, our aim at OA is to provide you with lots of them.
Welcome to The Focused View, the podcast for eye care professionals across Australia. Brought to you by Opticare. In each episode, we bring together leading eye care, optical and business professionals to share valuable insights, practical tips, and the latest trends shaping the optical business landscape. I'm your host, Michael Nasser, and together we'll explore innovative strategies for practice growth, patient care, and business success in the eye care industry. Whether you're starting your career, managing a practice, or just looking to stay ahead of the field, The Focused View is your source for inspiration and knowledge. Skye, welcome to the show.
Hi, Michael. Nice to be here.
Really great to have you and really excited about the things that we're going to discuss today. Just for the purposes of the audience, can you just give us a bit of a background about yourself and tell the audience who you are?
Yeah, certainly. So I'm Skye Cappuccio. I'm currently the CEO of Optometry Australia, so the professional body for optometrists in the country. I've been fortunate to work with OA for over a decade now in various roles related to policy, advocacy, education, member support. And prior to that, I've worked in various health peaks, primarily doing policy and advocacy work. It is policy and advocacy in health that is my passion.
And how did you get into that, if you don't mind me asking?
Gosh, that's a really good question. I think like many good things, you half fall into careers and half chase them. So I got to have a bit of a sample of some combined policy and project health work and realized how much I love chasing health system change, and then looked for all of the opportunities I could to pursue that.
I mean, everyone's obviously extremely familiar with Optometry Australia, and it's got a lot of different arms and functionalities and purpose. But with you being the CEO, and what is it that you're doing on a day-to-day basis in that regard?
I feel like my days are really, really hectic. So obviously the overarching role is to guide the ship. So to keep us aligned with chasing our strategy and our strategic plan, which I think is what we're talking about with Optometry 2040 is very much aligned with what our strategic plan is in the direction of. But whilst that's the goal, is to spend as much of time as possible on that, obviously as a CEO, you also spend a fair bit of time in the governance space and a fair bit of time kind of fighting little fires that come up.
Yeah, and I guess the governance space is probably the area that no one would really attribute with the role. And I guess if you can just highlight that, what does that look like? And for the optometrists that listen and other people that are in the industry that are listening, what does that actually involve with the governance and those types of activities?
So in a political advocacy sense, we are really lucky to have a team, including some optometrists who work on designing a political advocacy strategy that's aligned with our strategic goals and then work on a plan to pursue that. So a lot of that is perhaps the less sexy work of making sure our research strongly supports our push, making sure our stakeholders are on board with our push, making sure the department is briefed on what we're angling for, because you sort of don't want to turn up and advocate something at a political level without the department's support. So trying to get the department on board as well. And then also, obviously, there's the element that I guess people tend to see more of, which is the bit where you're actually engaging with politicians or with senior bureaucrats to try and sell your message. Often that's quite repetitive, but certainly there is definitely wins in repetition.
Yeah, obviously a very broad nature in the role that you're doing and the activity of your functionalities. But you mentioned that what we're going to be speaking about today, which is the Optometry 2040 project, and I guess breaking that down and discussing that in further detail, and that being aligned to the strategic trend of the industry or the strategic pull of the industry. Can you start off by explaining what the Optometry 2040 project is and what were the primary motivations behind it?
Yeah, okay, that's a good question. So we kicked off the 2040 project back in 2017, and it was really this point in time where we were hearing a lot of growing discontent from members about the future of optometry, for I guess a feeling that things were changing and that they weren't necessarily in control of it. So the underlying gist of Optometry 2040 is really about giving the profession an avenue to take control of its future by coming up with the sort of actions we need to take now to structure towards a preferred future. So we were really lucky to be able to work with some of the world's leading futurists, and you run through a process where you look at the the key trends shaping change in the world, but particularly as they relate to healthcare, and then particularly as they relate to optometry. And then imagining if those trends continue, how could they together shape different futures for optometry? So we try to limit it to just 3 different, what we call plausible futures. And we were lucky to have a lot of members engaged in this process who were able to work through this with us. And together they came up with 3 different potential futures. So futures that seemed plausible or likely based on the trends that we were mapping. And then the process was about saying, well, if they're the possible futures, which one as the profession do you want us to chase? And the idea being then they identified a preferred vision of the future based on things that were plausible. So not just a kind of pie in the sky exercise of what would you like optometry to be, but a plausible future, which one's preferred. And then we began the process of going, well, if that's the future we want to achieve, what do we need to be doing now? And what do we need to be doing in 5 years' time? What do we need to be doing in 10 years' time to make it more likely that that future will be realised? And there's some of those ones that the profession regarded as more negative that would be avoided.
And how long did that actually take? I mean, I guess from initiation through to completion.
Back in we did that project over 2017, 2018, and from the top of my head, it probably took 9 or 10 months. We were really fortunate to be able to travel around the country and this was pre-COVID, and do face-to-face consults with our members and stakeholders. So it was also a lot of fun.
I love the fact that you're tying in some realities there that are practical and not, as you mentioned, pie in the sky stuff. Because I imagine when you are looking to the future and you're trying to make those assumptions, there really is no limit. So to try and tie that down to something that's practical and relatable, and obviously then I guess, with some outputs that are going to be tangible for the industry. What were some of the key findings from the project that you came up with?
So we've also just done a refresh of the project, which is probably important to mention. And that was really about recognising that some of the key trends that we identified in 2017 and 2018 had changed a lot, particularly because of COVID. I mean, COVID really moved a lot of spaces in the health space in quite different directions. But our update and our 2018 work really landed on a very similar preferred plausible future that our members would prefer us to be chasing. It's a future where optometry is probably a multi-tiered profession, so where we have people working as generalist optometrists, as most optometrists do now, but with more and more optometrists working in kind of, I mean, we can't in a regulatory sense use the word specialization in optometry, but for the sake of this discussion, working in greater specialties in different areas, much more integration across primary healthcare, but also much greater integration upward with ophthalmology and other specialties as well. A lot of use of AI, real-time access data to really drive those relationships and collaborations with others, but to also support that increasingly advanced practice and different evolutions of expanded scope in different areas. I guess the picture that comes out of that is a greater diversity in the way optometrists work, and more optometrists working in a different range of settings and with the different ranges of modalities. So I guess that's thinking more optometrists in kind of primary healthcare hubs, working alongside other practitioners in different arrangements, more optometrists in the public health system, etc. One of the really interesting bits for me is that all of that relies on a lot of things, including continued evolution of scope, but it also relies on evolution of funding models to make this work in a sustainable and viable way. And so part of that vision is about more advanced funding or developments in funding models, so where it's not so reliant on fee-for-service under Medicare, but utilising different government funding streams, greater private health insurance input, and probably increased patient input as well in some areas.
Yeah, that strategic planning and that you're mentioning, and things like specialization. Well, we have to use that term very, very carefully, but having those areas of interest develop, are things that first come to mind, but the funding side of things is probably something that we don't necessarily consider. When it comes to funding, I'm sure that that's a really complicated and diverse conversation with regards to what that looks like and whether there's lobbying involved with governments and different initiatives in that regard. But are there things that are being done in that regard too to help prop up the healthcare sector and the optometry sector in particular? Or if you could speak to that really sort of briefly?
Yeah, so obviously optometry at the moment is particularly reliant on the fee-for-service model under Medicare. So a lot of what we do advocacy-wise is also making sure that is working to support practices and to support practices that they are to provide the kind of care that they need to patients. So we, for example, at the moment are starting the chase for some changes to make myopia management more viable. But at the
Yeah.
same time as doing that for optometry now, we also have to have an eye on what's possible in the future. So if we see optometry moving in to do increasing amounts of disease management, for example, we need to be looking at how to fund that. There's a lot of I'm not sure I can give a brief answer on this, Michael. It's one of my favorite topics. But there's a lot of discussion and very slow movement at the Commonwealth level in how they fund care. So increasing discussions about bundles of care, moving GPs in particular away from only the fee-for-service model, and combining that, so they might be getting some fee-for-service, but blending that with other payment models. The advantage for optometry, I think, is to be watching that now and seeing what works with GPs. So once that's so we can then chase what we think will be most effective for optometry in the longer term.
Yeah, got it. And how do you see Optometry 2040, Optometry 2040 project and the update that's recently been done impacting independent optometrists in particular?
So for independent optometry, I think Optometry 2040 gives them some guidance of where to start thinking about how they can respond to some of these trends that are shaping the future of optometry and of healthcare more broadly, and to start finding opportunity in some of those changing contexts to make sure that they maintain thriving practices sort of now, in 3 years' time, and into the future. The underlying message of Optometry 2040 is that we can support a robust profession now, but we need to adapt and we need to take well-considered change. And I think kind of gradual change is often the best option that responds to the change that are impacting us, so that we are helping shape them, so that they're not just shaping us, but we're helping shape them. I think there's lots of opportunities for practices to be doing that. I think one of the opportunities we already have practices obviously doing, but I think we will see more practices move into, and independent practices probably are already doing this at the highest level and are probably the greatest opportunity, moving increasingly into advanced areas of care, including disease management. But, the things that we already see independent practice doing in those areas, like advanced contact lens care, particular focus on pediatrics, I think there's opportunity to move further down those pathways and to align that increasingly with tertiary care as well, to provide that kind of comprehensive experience for the patient.
Yeah, and that's really exciting for an independent practitioner, knowing that, you've got these areas of development taking place. So I guess in light of that, what steps can you see practitioners take today to ensure that they align with the vision outlined in the 2040 project?
So at a practitioner level, rather than a practice level, my advice to practitioners would be, I guess, to keep your eye on the ball. So to keep your eye on the trends that are happening in optometry and related to optometry, in terms of the different spaces that optometrists are working, the different techniques, equipment that are increasingly available. Change there is actually happening quite quickly. So staying across that, I think, is a great way to identify the opportunities that you might want to chase and the steps that you might want to take. I would also suggest trying to pursue some of those opportunities to pick up that knowledge and to engage with other people who are also pursuing that knowledge. We as OA see that we've got quite a significant role to play here in supporting people to advance. And I think individual practitioners have opportunities to engage with what we're doing as well. So we've introduced an advanced practice recognition program to sort of start that process towards specialization, in quotation marks. We obviously run things like CPD on different uses of AI and what you need to be aware of if you're introducing diagnostic AI. We also run what we call COPE groups, which are communities of practice and education, but which really get small numbers of optometrists together who have a special interest to talk about how they can advance practice in that area in a viable way.
Yeah. I get a lot of positive feedback on those small focus groups or those smaller groups where they come together to talk about a particular issue or a particular topic. I can imagine those being quite successful. You mentioned something there about the advanced practice recognition program. Can we sort of get a little bit more detail with regards to what the main goals of that is, and I guess a bit more about that particular program?
You sure can. So the Advanced Practice Recognition Program is a program that we have only just publicly launched, but that we've been working on in the background for goodness, probably about 3 or 4 years. I think we have seen most allied health professions move in that direction of developing advanced practice pathways, and optometry is a little bit behind the 8 ball there. But we think there's obviously great opportunity to take the learnings from what our other allied health colleagues have done and bring that into our own program. So for us, the advanced practice recognition is really about, in the immediate term, it's about providing recognition for optometrists who pursue advanced practice in a particular area. It doesn't give them a broader scope of practice, but acknowledges that they've really dedicated time and energy to building expertise in an area. So that's what our program is aimed to do. It's kind of a structured way of recognising additional learning plus additional experience. And our initial one is focused on glaucoma. There is definitely intent that we will extend over time into other areas, but the first one is about glaucoma management. Yeah. So I think that's the short-term goal. The longer-term goal of the project, or the medium-term goal of the project, is really part of that Optometry 2040 vision. So it's about making sure we can make the best use of, we've got a really highly skilled workforce who are often not working to their full scope of practice. So providing a future context in which more optometrists are working more frequently to their full scope of practice. And advanced practice recognition is part of that, because it lets the community as well as other practitioners know that these people have particular expertise and a particular skill set in this area. I'm hopeful that we reach a space where, for example, practitioners who might be working in a more generalist role or who may not be as comfortable managing such advanced cases will be referring to optometry where that's clinically appropriate, rather than, for example, clogging up our very hectic public tertiary system.
Yeah, that's the industry obviously is quite dynamic with regards to the types of optometrists that they are. We obviously have our corporate chains, and you've got your more independents. And so I feel like there is that ecosystem there of being able to share that particular load, I guess, for lack of a better term, with regards to knowing that someone is maybe more advanced in a particular area that can assist the patient better. And so having a referral arrangement, or I guess hierarchy, it could be quite beneficial. And I think that's something that maybe isn't as done now, but perhaps as time evolves and this becomes more of the norm.
I think it's also in the advantage of the profession. Obviously, we have a growing profession, and there is some concerns about kind of maintaining good jobs for all of that profession. And so making sure that more people can practice at their fullness of scope also helps ensure that everybody has a good, meaningful job and a good, meaningful wage.
Yeah. You mentioned that glaucoma management was chosen as the initial focus for the APR program. Why was that the case? And you mentioned that there is going to be other clinical areas that you foresee being included in the program. What are some of those?
Yeah, so the short story of why we chose glaucoma is that we thought it was the area where there was the greatest benefit to the community and to the profession in the short term of recognising particular advanced skills in that area. The longer story to that is we were a little bit nerdy. We undertook quite a comprehensive piece of work early on, developing criteria that we would assess different areas of optometry against, so we could essentially rank which ones we thought that we would attack to begin with, and then second in line, etc. And glaucoma was consistently the highest, or glaucoma management was consistently the highest in that space. In terms of what we will do next, we did come out with a kind of initial ranking from that initial project, but that was done a number of years ago. And what we will actually do next is bed down glaucoma, redo that assessment. For example, the pediatric space, I think, has changed a fair bit, particularly with the growth in myopia management. So we really need to redo that assessment to see what we tackle next.
And you have mentioned to some benefits with regards to having optometrists that are focusing on particular areas, but how do you see this program benefiting optometrists and their patients?
For optometrists, it gives you a career progression pathway if you want to go in that particular area. We continually hear, particularly from earlier career optometrists, that they feel that they have reached a ceiling of what they're able to achieve or what they're able to do in practice very early in their career. So part of this is about giving them a career pathway in different areas that they can chase. As I said before, though, we also think a lot of it is about if we can utilise the advanced practice recognition program to change referral pathways a little bit and to make best use of community optometry rather than, for example, sending people into tertiary care when that's not necessarily clinically required. That's a win for the profession, but it's also a win for the community because it's cheaper care, closer to home, much quicker to get into, all of those sorts of things.
Definitely loving the work in that space and can really see that being something that the industry is working towards and something that will continually improve and get better at. If we change tune a little bit and focus on the scope of practice changes that you foresee coming and that are in the Optometry 2040 project as well, what are some of those key changes in the scope of practice that optometrists should be aware of?
That's a good question. So our interest is twofold. One is about supporting people to work to their existing regulated scope of practice, to their full scope of practice as much as possible. There is massive, in my opinion, massive growth opportunity there in a whole range of areas. We definitely see optometrists pursuing those areas independently, but the idea with Optometry 2040 is we support more and more optometrists to work into those spaces. There's also that other question about regulated scope of practice and what you can do there. Optometry in Australia is obviously, I guess, behind their cousins, for a lack of a better word, in similar countries. The US is probably the best example, but also the UK and increasingly New Zealand. From my perspective, there's a lot of opportunities there that are good for optometry, but also really good for the community and proven areas that you can pursue scope of practice change safely. But fundamentally, I think we need change for optometrists to be able to prescribe oral therapeutics before we can pursue those other avenues. So that is where we are starting. I think I've had about 35 political advocacy meetings in the last 2 months, really discussing the necessity of optometrists, therapeutically endorsed optometrists, being able to work to what is already their scope of practice and prescribe. So I would argue that they are already sufficiently trained to prescribe oral medications and prescribe oral medications within scope, which is obviously a lot of that is antibiotics and things like that. But that's a massive win, I think, to the community in terms of access. And for optometry, I think needs to be the first point of call for expanding regulated scope.
Yeah. So you mentioned the 35 meetings with regards to how Optometry Australia is advocating for these changes. Is there anything else that's being done, or is there anything else that can be done that you feel will assist in ensuring that these, I guess, measures are achieved?
In the oral therapeutics one, it has to go through our regulator. So the change has to be led by the Optometry Board of Australia. So we have asked them to make that change, and it's definitely something that they are looking into. And then they need to run quite a lengthy process of consult around that. And then they need to, because of the way our national law is set up, they need to get all of the state, territory, and federal health ministers on board. So a lot of our work is directed both at the regulator about encouraging them to make that change, but also directed at federal and state and territories about getting them to recognise that as that change comes through, that's something that they would view positively.
Yeah. And it's great that Optometry is doing this and I guess working towards making these changes because, as you mentioned, it is beneficial, I think, for the community at large with regards to getting access to medications potentially that an optometrist has, to some extent, therapeutically endorsed optometrists in any case, have the ability to do so. And as you mentioned, already trained, you believe in that regard. So to know.
I think if you look at New Zealand optometrists, they're essentially trained against the same competency standards under universities accredited by the same organisation. And they have been prescribing oral therapeutics with no concerns for 10 years now. And our therapeutically endorsed optometrists in Australia can fly over the ditch and sign a piece of paper and start doing so as well. So it certainly seems silly that we that we are not doing so.
Yeah, it's a matter of process, it sounds like, that, and sort of cross the T's, dot the I's, and hopefully it's sooner rather than later. What are the potential challenges optometrists might face with the new scope of practice, I guess, measures that may come in with regards to what you've seen, and I guess with reference to what you see in the States and the UK and also New Zealand?
I think there's a few things I'd say there. So politically, obviously, some of the challenges are about resistance from our medical colleagues, which is expected across the world, that there will always be that tension. But obviously, we've also seen advancements. Australian optometrists have been prescribing topical therapeutics with no great concern for a long time now. There is definitely avenues to move past those concerns and tensions, but I think that is always going to be the biggest political hurdle. But once those hurdles are overcome, I think for optometrists on the ground, some of the challenges are about making sure you get the right education so that you are, upskilled if you need to be to do whatever the scope of practice development is. But largely, I think that's something we know how to do. So we as an association know how to provide that. There's lots of international evidence on how you provide the right sort of education for different sorts of procedures, et cetera, et cetera. I think one of the other challenges we don't talk about enough is that if we're going to get scope of practice enhancements in order for the profession to take them up in a way that they do benefit the community and enhance community access, there has to be good funding streams. So to me, that's the real challenge around extended scope, about how do we fund it in a viable way, particularly when we start to talk about additional procedures.
We're speaking about scope of practice in a general sense here. We've spoken about the medication side of things with regards to oral medications that could be involved. What other types of scope of practice changes do you foresee? Or is there anything with regards to what that looks like? And I know that New Zealand have had a whole raft of variations recently, but are there things that we're looking to there, what we're trying to incorporate here? Are we able to speak to what some of those changes could look like?
This is probably not welcome news, but I think some of those changes are a bit down the track for Australian optometrists, and they really need to follow oral therapeutics. I think that's a basics that we need first. But obviously, some of the things that we've seen working really well overseas in terms of supporting greater access for patients are greater roles of optometrists in the intravitreal injection pathway. Doesn't necessarily mean that optometrists are injecting, but that we're using the skills of optometrists more effectively in that pathway. And greater roles for optometry in laser is obviously become quite common in the US and is now underway in New Zealand as well.
Yeah. And I guess just to wrap this section up, how can optometrists prepare and adapt for these changes? What's the best way that they can do that?
So I think for optometrists who are keen, there is absolutely lots of opportunity now to chase opportunities to work to your fullness of scope. Some of that, I think, is having great relationships with local ophthalmologists, being able to work in kind of formal or informal collaborative care relationships with ophthalmology that support optometrists to work at their peak of scope as much as possible. I think for those who want to, that's an opportunity that's there for the taking. And we as OA we have a staff member whose role is primarily supporting people to do that sort of work. So we're very happy to hold members' hands and encourage them to go through that process. I think some of the other things that you can do are stay on top of the literature, particularly the literature that links eye health with the role of eye health and systemic conditions, because I think as we start to move into the future and integrate more with other primary healthcare professionals in particular, that space becomes very, very important.
Yeah. And I guess OA is a resource that optometrists can look to with regards to these changes and what's coming up and getting more support in this space if that's what they're seeking.
Yeah, exactly, in a range of ways. So obviously we pride ourselves on providing high quality, up-to-date CPD and keeping people up to date. But we also have a lot of programs and access to optometry advisors for our members who want, help in particular issues related to them in terms of kind of building their own scope of practice.
Yeah. The next thing I want to talk about is probably a concept that people are becoming more and more familiar with, especially as it's an area that has developed in general practice medicine with regards to telehealth. And telehealth, we're used to it now, obviously post-COVID. And you did mention that, the 2040 project reassessed after COVID, and that changed the way we did a lot of things. I know one of the things for myself and my families, we have a choice of doing a telehealth conference now with our GP as opposed to going in. And that 50% of the time generally it works. And I guess if we then see how that could potentially translate in optometry, what are the current trends with regards to optometry in telehealth, and how do you see this evolving?
Yeah, okay. I think that's a big question. And I think you're right to say that COVID really accelerated the uptake of telehealth in Australia, and particularly normalised for patients and practitioners the notion of telehealth. I think there's great opportunity in there for optometry. At the moment in optometry, I think it's been quite well publicised that some of our larger corporates are rolling out a particular kind of telehealth, which they term remote care. That's obviously underway. They have indicated that that is likely to continue. We are seeing increasing rollouts of similar models to that internationally as well. I would also say that's not the only, that is definitely one kind of telehealth that is a current trend in Australia for optometry. It's not the only telehealth opportunity in optometry. So telehealth, I guess there's many aspects of telehealth, and often we get confused amongst ourselves about what we're talking about when we're discussing it. But telehealth can involve direct contact with patients via phone or video. It might be a three-way conversation between ophthalmology, optometry and the patient. And it can also, and this is a space that excites me quite a lot, be asynchronous viewing of reports between an optometrist and an ophthalmologist. I think that latter one is one of the areas there really is fantastic potential for optometry, particularly if we go back to that point about supporting more optometrists to work to their fullness of scope and to keep patients who can be kept within community optometry as long as possible. I think that provides great opportunity for that. It's not a new idea. There's been, obviously, Lions Eye Institute over in Western Australia has been running a successful model like that for quite some time now. But what is new is that opportunity to really scale it up into other areas as well.
Why do you think it's so important that the optometry sector in particular engages with telehealth? I mean, you did say something you're passionate about. What advantages do you see in all of this?
I think there's a few reasons. One, I think there's great patient benefit, and we can come back to that. And there's also great practitioner benefit. Partly, though, I think it's about accepting that it's happening. So telehealth is here in Australia. We didn't get great uptake over COVID in optometry due to lack of Medicare support, but most other health disciplines did. So it's definitely been normalised. Internationally, it's being increasingly normalised, for lack of a better word, for optometry as well. So I think the importance is if we don't proactively engage in shaping what we want that to look like for the profession, we risk it being done to us, where I think we're better off being on the front foot and shaping how we think it works for our profession, our practices, and our patients. So I guess that's about ensuring telehealth's employed in a way that supports better patient access, upholds good care standards, and is also financially viable for the profession. So to me, that's the underlying reason of why we need to engage so that we can shape it in a way that is positive.
Yeah, and you mentioned, the benefit to the patient. So how can telehealth add value to both the patients and to the optometry practice too?
I think there is a myriad of different ways depending on the kind of telehealth that you are using. I think that telehealth often supports greater access for patients. We're used to thinking about the use of telehealth for remote patients in the bush somewhere. And certainly that's the older model of telehealth. But as you mentioned, you can now access your GP online. Often that's just more convenient. So there's those sorts of opportunities for the patient. There's also those opportunities for the patient who might be referred out of a metro public hospital, and the optometrist can pick up that care with some telehealth relationship with the ophthalmologist at home, and the patient can return home to access that kind of remainder of their post-surgery or whatever it might be care. So I think there's lots of benefits for the patient there. There's benefits for practices too if they are willing to accept that that there needs to be a financial payoff for this. For example, I think that there are some practices, and this is probably more common in independent practices at this point in time, where there's already kind of semi-regular telehealth happening, but it's not seen as a clinical service. It's just something that's done with no payment exchanged. And I think there's ways to think about the process that you wrap around that so that it's perhaps more financially viable for the practice.
And is Optometry Australia looking at those type of programs or systems with regards to how that could roll out in practicality for a practitioner or for a store?
We are, but we're at the very beginning of those considerations. And I would also say there is obviously other players, business players in the market who are sort of thinking about how you could support optometrists to do that as well.
Yeah, I've recently been, well, not recently, earlier this year, went to New York and went to the conference there, and there were quite a few solutions there. Obviously, they're probably slightly more advanced with regards to telehealth with optometry, and some of the testings and some of the things that they've created with the technology was really interesting to see. So you can definitely see that trickling down to us at some point, and it is very much part of that future. So when we're talking about the future of optometry with regards to the 2040 project and what things are looking like in the next sort of 10, 15, 20 years, it's without a doubt going to be a part of the industry. So we need to embrace it and sort of see how we can make the most of it to ensure the benefit for the patient and obviously for the practice as well.
I think you're right. I think there's lots of developments in kind of clinical tech there, but also lots of developments in digital sharing. So things that enable you to share imaging of greater quality, to keep up to date and shared records. They are telehealth solutions too, in a way that enable optometrists to do more for their patients, to work more consistently.
Yeah. That's a great, that's exercising their full scope there and collaborating with other related professionals, whether they're GPs, whether they're ophthalmologists with regards to the management of patients. So there's a massive opportunity there too, which I wouldn't have first thought of, but now that you mention it, it makes total sense.
I think we're seeing increasing uptake of those, kind of models. They're happening in little pockets or being piloted in little pockets across the country, but I think they will become increasingly common.
Yeah. So I guess what steps can optometrists take to effectively ensure that they're integrating telehealth into their practice? Is it about being aware? Are there any other steps that you'd recommend that they take at this stage?
I think it's dependent on the type of practice that you have and your kind of practice's appetite for change. I think if you start from the premise of what can add value for my patients and then look at the different opportunities that come out of that. For example, I think rural and regional practices in particular have great opportunities to be doing things like picking up in a telehealth way some of the patients that could be referred out of metro hospitals. Some practices have opportunity to potentially be considering billing for telehealth follow-up care of various sorts. Obviously, there's limitations to what you can do there, where they might currently be providing that care without billing. So I think there's lots of different opportunities if you kind of think broadly and a little bit outside of the box.
And I love the way you started that, which is, think about what value you can add to your patient in your particular practice and start with that in mind, and then allow that to sort of influence your decision-making as you take this particular challenge on. How you see the landscape of optometry evolving in the next few years based on the findings and your experience with the 2040 project and the update that you've done with it recently.
Some of the notable trends, I would say, is that we have a large and growing workforce, and I think we are at the edge of tipping over from the supply-demand balance is changing, which is a kind of nerdy way of saying I think we're tipping over into potential oversupply of optometrists at the moment. So that's one trend.
Okay.
We also obviously have massive ophthalmology workforce shortages across the country, which are predicted to continue for a long time yet, and extremely overloaded public ophthalmology systems that don't seem to be improving. Alongside that, I think another key trend is that we have increased digital connectivity. I mean, digital health solutions are always much slower than promised, but they are definitely progressing. And alongside that, we have ongoing increases in diagnostic AI and its potential to be used in optometry. I think if you look at those three trends, some of the things to me that they mean that we'll see in the next few years, those three trends to me create a greater opportunity for more optometrists to work to fullness of scope, greater opportunity for collaborative care approaches, particularly collaborative care approaches that keep people out of public hospitals and in community optometry settings. Lots of that work is already happening, but I think as a trend in the next few years, we're going to see more and more of that. And as I said before, that's something that OA is really keen on fostering, and we're working proactively to foster. As we've already talked about, I think those trends mean that we have to start catching up the scope of practice boat to similar countries because the community needs that to happen, and because we have the optometry workforce that is big enough and skilled enough to make that happen. So I think one of the trends we'll see in optometry in Australia is a quickening of that kind of growth of scope. I think, as we've also talked about, we're going to see greater intra-professional referrals and greater specialisation. That might take a little bit longer, but I think that's the direction we're heading. We will have to, with all of those trends, to realise all of those things, seeing some kind of change in the way optometry relates to government funding, and probably a bit of a change in business models to accommodate.
Yeah, and I love your observation there of the oversupply potentially of optometrists, and then how that could feed into where the undersupply is and how that all marries together, in coordination with the things that we're working on or that you're working on in that regard. So when you paint the picture like that, it makes sense as to the strategy and what's coming up and why maybe the demand of the community will accelerate that particular process as well and get us to that more full scope for optometrists than we have had in the past with regards to the time it's taken. What new challenges do you anticipate will arise in the field of optometry? Maybe a little bit more general in nature, but I guess with your experience and what you've seen.
So I think that there is definitely challenges with potential oversupply, which is why we need to work really hard, I think, to make sure that we are growing scope of practice, growing demand for optometry services, seeing more optometrists work in different settings, because otherwise I think we have a significant challenge on our hand for the profession. One of the other areas that is of really interest to me is what's going to happen with diagnostic AI in the eye care space. So there is obviously diagnostic AI out there on the market. There has not been a huge amount of uptake at this point in time in Australia in community optometry. I think there's strong potential that we might see usage of that outside optometry as a screening tool. For optometry, there's great risk in that happening and great opportunity. So to me, that's one of the challenges. We need to be on the ball to make sure if that does happen, it happens in a way that more patients who need care are being referred into optometry, not less.
Yeah. And are there any models that you've witnessed or are privy to with regards to the US or the UK that are pioneering AI with regards to that diagnostics element?
My understanding is that there hasn't. So there's obviously a lot of
No.
different applications, but there hasn't been
Yeah.
wide uptake just yet. But I think we're
Yeah.
sitting on that precipice at that moment
Yeah.
where it could happen at any moment in time.
And I guess being mindful of it at this stage just, keeps you aware. And then obviously when it does happen, you'll notice it relatively quickly and then you'll say, okay, this is how it's now rolling out. But yeah, really powerful.
And for us, I think it's about catching that before it takes on so that we can make sure that the referral path, if that does happen, that we can make sure any referral pathways that come out of that are getting patients to where they need to be, which is in community optometry rather than into places where they might not be able to access care.
We've sort of touched on this particular question throughout the conversation, but what can optometrists do to prepare for the future challenges as envisioned by Optometry 2040 project and the update? Is it a matter of just sticking with OA with regards to keeping an eye on what you're doing, sort of pioneering this sort of area, or are there other things that they can do to prepare for these future challenges?
So I think, and I've probably said this before, that Optometry 2040 is really about harnessing trends to capitalize on the opportunity and minimize the risk. So the trends are happening. How do you turn them into opportunity, not risk? I think if you can take that own mindset, so there's obviously really practical things you can do, but at a bigger level, if you can take that own mindset into your own career, that's a really powerful tool for creating positive personal changes and opportunities and positive business opportunities. And obviously, if you're looking for some ways to capitalize on those opportunities, our aim at OA is to provide you with lots of them.
Obviously, we're speaking a lot about the optometrist and the practitioner in this instance, but what about other members of the optical community to a larger extent with dispensers and I guess, anyone that's working in an optical practice or an optometry practice, and that could include optometry dispensers that are store owners or,
Yes.
other store owners. I guess in all of this, speak to them, and what would be some advice that you'd say to them with regards to what they should be thinking about too for their businesses and the services that they're providing the community?
So for business owners, the same premise relates that if you are focused on what your patients need and how you best meet that, and then you can start thinking about how you do that in a viable business way behind that, and looking at the way the trends are changing, how what your patients will need into the future are being shaped, how that trends is being shaped. I think that's a really positive move that you can take.
And you probably want to leverage your optometry staff, or your optometrist staff in particular, and making sure that they're in tune with these things and not ignoring them, and then, getting them to communicate with you as a store owner or as someone that's not an optometrist within the industry. What's the significance of this and how is this important to our business and how can this help us, provide a better service to the community? They're little things as well that might assist.
That's right. And I think part of that is if you're a business owner thinking about how do you want to position your business into the future, because there's things you can do now to create opportunities for your optometrist to step more into certain spaces. And there's things that you can do that shut down those opportunities for them. And depending on where you want your business to be in 5 years, one of those may or may not be the right option.
Yeah. And I guess that speaks to the fact that our industry is really unique in it's an allied healthcare service, but it also is. Certainly, we've spoken about Medicare funding, but if you look at, the income of an optometry practice in particular, so much of it comes from the retail side, whether it's with the frame and the lenses and that side of the business, a sale of contact lenses. And so obviously there is a continual pushing and pulling of how do we manage the clinical with the business side and making sure that they marry up too. And so I think as an optometrist owner, obviously you're very mindful of that because you're probably being exposed to OA and CPD points and all these things. But as a business owner that's not an optometrist, there might be some variations there with regards to your perception, but being involved, with the optom, I think is really, really important in that
And
regard.
I would certainly say, I think if there are optometry practices who are looking to double down, I guess, on that clinical space, not as much on the kind of optical appliance space,
Yeah.
you have to commit to making that a business viable option as well, which means you have to charge fair amounts for clinical care.
That's a great point. For those stores or those practices, there seems to be an avenue there that they can become a little bit more knowledgeable within a particular area and then obviously harness that and then potentially charge for that too, I feel. And so that might facilitate an ecosystem in the industry where you don't have to necessarily rely so much on the sales of frame and lenses. Maybe you do focus on more of that clinical side, provided that you're charging as well. So I think that's a pretty exciting concept for optometrists in particular going forward.
We've seen quite a few independent practices do that already, and I think we will probably see more and more of that happening.
Yeah, that's great. To wrap it all up, what final piece of advice would you give to optometrists to help them align with the future vision of the profession?
Well, I think it's probably the advice that I just gave to stay mindful of the trends and be willing to adapt. but also to make sure that your moves in adapting are very well considered. And to also reach out. I mean, optometry is really lucky to have a strong, that sounds like I'm speaking us up, but I guess I am, to have a really strong professional association. And I think to be able to reach out and discuss some of those areas and issues that you're encountering across the spectrum of kind of changing towards the future is a great opportunity. So certainly encourage people to take that opportunity as well.
Awesome. Thank you so much for your time, Skye. I've really appreciated this conversation. It's been really interesting to look at the industry in a little bit of a different light with that future focus. I think it's quite exciting and it's quite empowering with regards to understanding what's possible and what's in the future and how that all can marry up to what we're doing today as well. If people want to reach out to you, what's the best way that they can find you? If they have questions about what we've discussed or want to find out a little bit more, what's the best way that people can reach out to you?
If they reach out to us via our Optometry Australia email address, which I think is national@optometry.australia or national@optometry.org.au, then I would be very pleased to be in touch.
Cool. And we'll have that in the show notes. We'll make sure that's the correct email and we'll put it up there so people do want to reach out and get more support they can. But thank you so much for your time, Skye. I really appreciate it and all the insight that you've shared with us today.
Thanks, Michael. It was good to chat.
Stay connected by subscribing to The Focused View and visiting our website, www.thefocusedview.com.au, for additional resources and episode summaries. We look forward to your company again in our next episode. Until then, keep focused. I'm Michael Nasser. Bye for now.